Imagine this, you're in a loving marriage with 2 young kids, living your best life. You decide to take an oral contraceptive pill. What could be the harm, right? Except that you start to have some bad headaches and some dizziness. Common side effects, but no big deal, right? But they slowly get worse. So bad, in fact, that you end up in the emergency room. What happens next changes your life forever. Stay tuned to find out what happened. Danielle, thank you so much for joining us today to share your story about Compazine. Let's just start at the beginning. How did you end up? Well, actually, just tell us a little bit about yourself. How old are you? Where do you live?
I am 35. I live in Southern California. I'm a mom of 2 young kids, 5 and 7. I like being outside. That's why I live here in California, and I don't like the rain.
How did this nightmare begin? When did Compazine come into your life? Tell us that story.
So I had hormonal problems my entire life. And at 34, I was talked into taking birth control. And so at the time, I didn't realize that headaches were a side effect of birth control. And so one morning I had woken up and I had the worst headache I've had my whole life. So I've always had health anxiety. Like, I don't hide that. I've always terrified that I always have the worst case health anxiety. And so I went to the emergency room thinking like something was seriously wrong with my brain. They had asked if I was nauseous. I had said, oh yeah, kind of. I'm just more concerned that I have like a tumor in my brain or something's going on. So he's like, we're going to give you something to help you out. At the time, nobody told me what it was. I think I just assumed, which is my own fault, that it was like a Toradol or like an Advil of some sort. And almost within seconds of the Compazine in my arm, my entire arm was burning. I wanted to rip the IV out of my arm. My skin was crawling. But at the same time, I also was given Benadryl, so I was like paralyzed.
And just for those who may not be aware of it, could you just tell the audience, what is Compazine?
I didn't find out till later, but I guess they use it for migraines. Typically, one of the ER doctors told me when I've gone back numerous times that it's pretty much given in all hospitals for severe migraines, that and some other nausea medicines. But I came to find out after the hospital that it's actually an old antipsychotic that they have recycled for nausea.
That was a surprise to find that out.
Yeah.
And so walk us forward from there. Sounds like you're sedated. You've been given some Benadryl. You're already starting to have side effects, burning, all of this. How did things unfold for you after that?
I think I was so terrified of what was going to happen if I mentioned anything. So I was waiting to get a CT scan, which I almost canceled because I just needed to get out of there. Like, my skin was crawling. I just felt like I was exploding. So I finished up the CT and then I was like, I need to go. My husband had picked me up, and then immediately I started having this pacing. Like, I had even called my mom and I was like, it feels like I've done drugs. Like, I couldn't sit down. I would sit down, then I'd get back up. I would sit down, I'd get back up. It was just this insane feeling. And so it was Halloween actually. So we were getting ready to do trick or treating. And I remember telling my husband, I'm like, I can't sit still. Something's really seriously wrong. I had called my primary and she's like, I think you're having side effects to the Benadryl. Sleep it off. And then the next morning, it was still there. And then the next morning, it was still there. And so then I went to my primary, I think 3 days later with my husband, because at this point, I felt very suicidal, something was really wrong in my brain. And she diagnosed me fairly quickly with drug-induced akathisia. But she wanted to give me 2 antidepressants and also told me I should go check myself in to the psych ward at the hospital.
Wow. I want to pick up on something just because sometimes it can be hard for people who are unfamiliar with akathisia, that side effect, to truly know what it's like. Just take a moment and just explain what that feeling was like for you in your body going through that, and maybe still going through it now, actually.
Yeah, I still definitely go through it now. It almost was I don't know, it didn't feel like it was my body. I really wanted to jump out of my body. It felt like my skin was crawling. I couldn't relax at all. All I wanted to do was either sleep or just watch TV, and I just could not stop fidgeting. It was just the most uncomfortable, unnerving side effect I've ever had in my entire life from anything.
What is it about being in that state that that led you to start having suicidal thoughts?
I think it was just like uncontrollable. Like there was nothing I can do to control that feeling. And it just made me feel like I just didn't know what to do. Like it was just this awful feeling, no matter what, I couldn't turn off. And it was just, if this doesn't end, like there's no way I can live like this for another minute. Like I just couldn't even relax. I couldn't sleep. I was having severe insomnia. Like I'd wake up every 2 seconds from sleep, like my heart exploding.
Your story is kind of different from the ones that I usually get on this channel, because most people, their doctors don't pick it up. They tell them that they have anxiety, but it seems like your doctor actually was pretty wise to what was going on.
Yeah, I was pretty
and you
lucky.
got a diagnosis quickly.
Although she did say that after 6 weeks, it wouldn't last longer than 6 weeks. So when I still felt like that after 6 weeks, she's like, you know, you're having severe anxiety. I think you're having a mental illness at this point. Like you need to go find a specialist to talk to. So at that point, when she wanted to just give me a bunch of new drugs, which I've never been on any antidepressants before, I was like, I can't get on a drug, because I had been on Facebook at this point and knew that if I continued to take medication, it could get progressively worse.
So walk us forward from that point. So you've gotten the diagnosis from your doc. You're a couple of weeks into it. It's not going away. How have things unfolded for you since then?
I've had a little bit of panic, like panic attacks prior to this, like years ago, I think hormonally related. But I started getting to the point where I was like, it's not going away. Like I can't be a mother to my children. I can't work. I couldn't drive anymore. Couldn't leave my house. It just got to the point where I was like, it's not going away. I'm not really sure. I debated going on medication because so many people in my life were like, you need to get on something. Like my own mom was like, every day, you need to get on Lexapro. And I'm like, this doesn't feel like anxiety. This is completely different. Like something is seriously wrong and there's nothing that I'm going to be able to fix it.
Did you feel like you were on your own when it came to knowing that you were having a drug injury rather than anxiety?
Yeah, I still feel like that. I'm really lucky that my husband like clearly knew that like I went to the hospital and I came out a different person, because he's obviously been the most supportive, but like none of my family lives near me. So they don't see the episodes that I have. They all just think it's mental. So that's one of the hardest things I think that makes like at least my suicidal ideation worse, is like no one believing me. Like, how do I go into the hospital, a normal person and mother, and I come out a completely different human being? Like, it was like night and day, but I guess because they don't live near me, they didn't see it. I don't know. But that's a really hard thing, is like, at this point, no doctor believes I'm still suffering from compazine. Nobody does in general.
How long ago did that all happen?
It'll be 19 months at the end of this month.
Have you had any improvement during that time?
Not really. I mean, sometimes I feel like I could be like improving, but I think I've been on other medication like antibiotics, which are setting me back. And I think that's making me get worse at this point.
What does it feel like to have something like this come in and affect you at this point in your life?
It's hard because I'm only 35 and like I don't work anymore. So I've lost that. I used to be really into like exercise. I've lost that. I feel like I've lost a lot of relationships with my family and people in my life. I don't really try to have conversations because I do have like DPDR, like depersonalization. Sometimes I don't know like what day it is or like what's going on. Like I'm just there, but I'm not really present in my life. Like there's a miscommunication between my body and my brain, I think.
How has this affected things with your family?
It's hard because my kids ask me daily, like, when are you going to get better? And it's like, I really can't give them an answer because in my feelings, I feel like I'm never going to get better. Like, and you know, my husband's great, but like, it definitely affects our marriage. And like, he carries the burden of the finances and like all the medical expenses that we've compiled because of this that have gotten me nowhere. So it's just, I feel guilty, but it's like, I can't change. There's nothing I can do to change it right now.
Can you give us an estimate of how much this has cost you financially to try and get care and treatment for this?
Yeah, probably between this and like the urinary tract infections I've gotten after compazine, probably like, I believe $20,000 to $30,000.
Oh my God. What were you doing for work?
I was working at a law firm, doing billing and stuff. And so once my daughter got into kindergarten this year, I was going to be working again full time, but now I'm not working at all. So
can you give me a sense of how something like this affects your relationship with your spouse?
It's hard. I feel guilty about it all the time. And I feel like he doesn't talk about it just because he doesn't want to put any more burden on me. But clearly he suffers. You know, obviously it's not comparable to mine, but like he clearly suffers and is going through a lot too, because he's lost a friend, a spouse, support, and another parent helping him. Like for the longest time, like I couldn't drive at all. And so like if my kids needed anything, like I couldn't even get out of bed the first 6 months at all. So wow. He carries a lot of the burden of taking care of me and the kids and the house and the finances.
How has this affected your relationship with your children?
I think that's the hardest part, because I always say that if I didn't have kids, I'm not even sure I'd be here today, because wow. I'm really fighting for them to not lose a mother to something as simple as like a medication reaction. I try to be present with them as much as I can and not let them see, you know, how I feel, but they've definitely seen the episodes of akathisia because I can't hide it, you know? There's moments where there's nothing I can do and I literally just need to let it out.
If you were to look back at the last 18 months, what has been the hardest thing for you about having this drug injury?
I think being a mom to young kids, watching my kids suffer because of me. It's been the hardest, and not being like the mom that I was prior to the drug reaction. Like this was 2 years ago, and I feel like my kids don't even know the mom I was prior to this. I think the biggest thing that worries me, that if this drug reaction or a new drug reaction were to take me, like this is the memory they have of me as a mom, which is just nowhere close to what I was prior to it.
How do you see them suffering?
My oldest is more in tune to it. Like he'll ask me like, when are you going to get better? Or he worries that I'll pass away, or like, are you going to die from it? You know, and just that like they ask me to do something at sometimes where I physically can't do it. And it's like, I want to, but my body and brain don't allow me to. So I unfortunately have to be like, you ask your dad. And it's just like horrible, because there's nothing I can do. My body won't let me do it.
How do you feel about the doctor who prescribed you this medication? You know, looking back on everything that's happened.
I mean, I have a lot of anger with it, just because, like, again, I wasn't that nauseous. You know, he probably spent about 5 seconds with me. Didn't really answer many of my questions. I was also nervous about the radiation from the CT scan. He didn't really make me feel comfortable with that. He just said, I'm going to have the nurse come in. She put it in my arm very quickly. I found out later you're supposed to do it slow. I mean, she injected me very quickly, but like, I just have a lot of hate and like anger towards him. I really do. Because if I would have ever known that it was an antipsychotic, like I have health anxiety prior, I would have never taken that drug. Like I would have suffered nausea for years.
I mean, something that surprises me about your case is there's other medicines like ondansetron, which are really commonly used for nausea, which don't have that side effect profile. Were you offered anything else that was more benign? I wasn't offered anything else.
I've been in the ER before when I was pregnant, or like not pregnant, for nausea, and I've always gotten Zofran. I've always been fine with that. Never was offered anything else. And never even, looking back, I realized like, when you go to a hospital, they never tell you what they're giving you. Like, I was so sick at that time with the headache that I wouldn't even have thought to like ask what they were giving me. Like, I didn't know that this kind of reaction would even existed at that time.
Has it ever been acknowledged by the hospital that that this was a result of something?
No, I made a complaint with the hospital early on. I actually have worked, like I said, at a law firm for 15 years. I've tried a couple of different attorneys, and no one would take my case.
Wow.
It's interesting too, because I had postpartum after my son really bad, and it felt kind of similar. So this last week, I actually had asked for my hospital paperwork because I had him in Portland. I came to find out I got Reglan twice. during my labor with my son. And I believe that I suffered some kind of akathisia after that because I didn't get it with my daughter.
Reglan, that's metoclopramide, right?
Correct.
Yeah. So again, very similar to compazine in that it's a nausea medicine that can cause akathisia and movement disorders. Yeah. Okay. So have you been able to get any support through things like disability for what's happened to you?
No, because I can't get anybody to take me seriously. There's no way, the drug's not in your system anymore. But even me, not as a doctor, it changes the dopamine receptors. It doesn't matter if the medication's in me anymore. It's made some kind of change to my brain, but I can't get anyone to believe that that's an issue.
How much support do you currently have going through this from medical professionals?
At this point, I've kind of stopped seeing them because everyone just says, like, I have anxiety, I need to be on antidepressants, or I need to check myself into a mental hospital to, like, get help. But, like, I've never been on medication before. I don't think, I know for a fact that I'm reacting to a lot of things, even supplements at this point. So, like, I know for a fact if I was given an antidepressant that I would have similar reaction, if not make my injury worse.
Is it hard to keep going with what you're experiencing on a daily basis?
It is.
Yeah. How do you find the strength to make it through the days?
My kids. Because I know they need a mom. And also I don't want to lose my life over a drug reaction. Like I guess I can't get past the fact that, like, it was one drug. It's not like I was given anything else after that. And I wasn't taking it long term. I guess it's just, like, shocking to me that, I get one dose and, like, it's lasted this long.
Do you think this injury's made you closer as a couple, or it's pushed you apart when you look at your relationship with your husband?
Pushed us apart, I think. I mean, he's supportive. He's there. He wants me to get better. But, I mean, like, I don't feel connected to anybody at this point. Like, I don't really have emotions there at all other than sadness. And I'm in a phase of, like, anger lately.
And I know you mentioned you were angry at the hospital, but what are some of the other, angry thoughts that come up at this time point?
I guess I'm kind of angry. Like, I love all my family and stuff, but, like, I definitely don't. I know people don't see it. Like, my husband sees it because he's with me every day, but, like, I definitely don't feel like I have any support other than my husband at this point. My mother-in-law thinks I just have, like, a mental illness. I mean, she, in the beginning, would tell my husband, like, you need to get her checked in somewhere. Like, this isn't good for the kids. When I just knew that it was something different, my mom and dad will be like, you need to get on some kind of medication or go somewhere. Not realizing when I'm trying to explain to them what akathisia is, they just don't get it. Like, you can't treat a drug reaction with more drugs, in my opinion. Like, I just don't see how that's a possibility. I've taken a couple of antibiotics since my drug reaction, and the suicidal ideation, I can't finish the antibiotics. Like, it's no one gets that it's life or death. Like, the antibiotics are life or death for me. Like, I can't tolerate them at all.
And with your family and your mother-in-law, believing that this is more psychological than medical, where did they get that idea from? I mean, is that, what makes them believe that over the alternative,
so
which is that you've had a drug injury? Yeah.
Because I've always had health anxiety, and I've had panic attacks, and because I had the postpartum, which I'm now relating to the Reglan because I just found that out a week ago. Like, I remember calling my mom after my son, like, suicidal like that too. Like, I wanted to run away. So, like, I think because I had past of, like, anxiety and health anxiety, because when my kids get really sick, my daughter had bad blood work, I always assume the worst, like leukemia. So I've always been like that, but these are feelings that, flee away after a day or two, and I, like, can send her back. This is, like, I think they think because of my past, oh, she's just panicked. Like, even my mother-in-law was like, if you put just as much positivity into your negative thinking, you'd be fine. But, like, there's no amount of positive thinking that's going to fix something in my brain. I mean, I try to be positive, but, like, positive thinking is not the cure.
I imagine your mother-in-law is probably not your favorite person when she's saying things like that.
Yeah.
Yeah.
I mean, it's been hard. I've distanced myself a little bit from my mother too, just because every time I call her in an episode, it's like, you need to get on Lexapro. Like my mom's on Lexapro and she thinks it's the greatest thing on earth. But it's like, the last thing I want to do is take any kind of medication if I can't tolerate antibiotics and supplements and anything else.
Why do you think your mom is encouraging you to go on Lexapro, I guess, after you've had a drug injury?
I think she thinks it'll fix me. Sometimes she's still like, until recently, would be like, how do you know you have akathisia? Who diagnosed you with that? And it's like, my doctor has, I saw a neuropsychiatrist, he has, like, it's been, and it's a common thing. Like my doctor told my husband when we were there that day, like, it's a really rare side effect, but it happens to 40% of people that take Compazine. And my husband was like, 40% of people is half the people you're giving this to. So that's not really rare.
How has this whole experience made you view the medical profession?
Like at this point, like I'm just done with Western medicine. Like I get terrified to take my kids to a doctor, like severe anxiety about going to any doctor because the fear of like, no matter what I go to the doctor for, it's always some kind of prescription. My kids had a really bad cold and the first thing she wanted to do was give him a steroid, which, you know, you look at all the drugs that can cause akathisia and my son already has like anxiety. And I was like, this is not, I can't do medicine at all. Like I try to do everything natural for my kids the best I can because I'm terrified of like, if my kids were to suffer for like this, like, I don't even know if I could ever function again.
Do you have a message or do you have anything that you would like to share before we wrapped up?
I just think, you know, for me personally, we put too much trust, I think, in doctors and Western medicine. I think we think that there's a drug to fix everything, but the drugs are more just a cover to cover like what is like that particular thing you're having, and it causes other issues. I've seen really good functional medicine doctors. I've come across other issues that could be contributing to my akathisia that like a regular doctor would have never admitted to, tested me for. So like I am working with functional doctors to try to get my body in tip-top shape to continue to heal. But like, I just think, you know, we put too much trust in like drugs and medication, and whatever a doctor gives us is the answer. And I really think people have to do a little bit more research before you just listen to a doctor and take any medication that's like prescribed.
I think that was so on point, especially given the start of your story where you were having severe headaches from the oral contraceptive pill. This may be a crazy idea, but maybe the doctor should have told you, stop the oral contraceptive pill, maybe bad for a couple of days, come back if it's still severe.
Yeah.
Before they started exposing you to all these additional drugs.
The neuropsychiatrist that I saw, he pretty early on, like a month after my reaction, he had asked me to stop the birth control pretty immediately and was like, you know, they're synthetic hormones. Like, I think you need to get off of those immediately and let's see if that helps any of the symptoms. Unfortunately, it didn't help my symptoms, but...
Well, Danielle, thank you so much for coming on and sharing your story. These are really important stories, and it just shows just how quickly things can change. And so I really appreciate you coming on.
You're welcome. Thank you.
Check in with me. Let me know how you're doing. I do like to invite people back. And so if there is a change, either good or bad, I'd like to hear from you.
Okay. Thank you.